Hi, I'm Nathaniel Young. On behalf of my co-authors, I'm presenting the findings of our systematic review titled Variation in Outcome Reporting in Studies of Fertility-Sparing Surgery for Cervical Cancer. The aim of the systematic review is to identify and characterize the reported outcomes in studies investigating fertility-sparing surgery for cervical cancer. This in turn will form the groundwork to develop a core outcome set as part of the Crown Initiative. We included published randomized controlled trials, cohort studies, observation studies, and case series with a minimum of 10 participants who had fertility-sparing surgery with a confirmed diagnosis of adenocarcinoma or squamous cell carcinoma or adenosquamous carcinoma of the cervix. In total, 104 studies were included in the final analysis, with a cumulative number of 9,535 participants. This review drew 5 broad categories of outcomes: intraoperative, postoperative, fertility and pregnancy, oncological, and quality of life outcomes. Oncological outcomes were the most commonly reported in the scientific literature, while only 5% of studies included outcomes relating to quality of life. Patient-centered outcomes were lacking, and outcomes most frequently reported are those which were easy to collect and not necessarily meaningful to patients. Commonly reported outcomes identified in this review include intraoperative blood loss, postoperative complications, successful conceptions, and survival. Our data highlight a great deal of variation and heterogeneity in the reporting and assessing of outcomes used in studies of fertility-sparing surgery for cervical carcinoma. Additionally, definitions for outcomes were often either lacking or varied, for instance, when describing first or second trimester losses. These findings make drawing comparisons between studies challenging and highlight the need to develop and implement a core outcome set. It's essential that patients and public stakeholders are involved in the development of costs, and that the final cost also reflects outcomes which are important to them. A defined set of agreed core outcomes is critical to facilitate well-designed future studies, prevent unnecessary duplication of research time, and allow meaningful comparisons between studies, all of which will advise clinical practice, driving forward management change and informed decision-making. Thank you.